Hi everybody. Today we are going to talk about cultural awareness, and I apologize if I'm looking down a lot. I'm working with actual notes instead of note cards today. We're going to start off with talking about obstacles to good health. These include more things that are not on this list, but this is just kind of the general basis. We have racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, and geographic location. To elaborate on that a little bit, I'm going to go into depth in a few things that have higher risk factors in certain cultures and certain races. The differences in rates of cancer, diabetes, infant mortality, organ transplantation are affected by culture. African Americans have the highest mortality rate of any racial or ethnic group for all cancers combined. Asian Americans have the highest incidence of liver cancer for both males and females. Hispanic youth ages 2 to 19 are more likely to be diabetic or obese. The LGBTQ community has a higher risk for depression, anxiety, substance abuse, and 4 times the suicide risk. American Indians and Alaskan Natives have the highest risk of infant mortality rate. It is 60% greater than those of white children. And African American infant mortality rate is 2 times that of the white population. I couldn't find any studies that specified why. It's just important to know that you need to take special care with these infants. Now we'll talk about something that's very similar. We're going to talk about health disparity. Healthy People 2020 defines health disparity as a particular type of health difference that is closely linked with social, economic, and or environmental disadvantage. So that's all of the obstacles to good health that we covered before. So just kind of breaking down the word of disparity, parity itself means equality, so disparity would mean inequality. Next, let's cover marginalized groups. Marginalized groups are more likely to have poor health outcomes, and die at an earlier age because of a complex interaction between individual genetics and behaviors, public and health policies, community and environmental factors, and also quality of health care. So it's important to think about those people that come from rural communities or very underprivileged communities, even from third world countries that come over to America to receive health care. So these are things we need to be thinking about when we're treating these patients. Next, we have social determinants of health. And this again is just kind of elaborating on what we've covered earlier in this discussion. Social determinants of health are conditions in which people are born, grow, live, work, and age, shaped by distribution of money, power, and resource at global, national, and local levels. Examples are income and wealth, family and household structure, social support, education, occupation and discrimination, neighborhood conditions, and social institutions. So here we want to think about, did this family come from a broken home, from a very impoverished home? Do they come from a neighborhood with a lot of gun violence? Things like that. Our next topic is very important because it not only affects our patients, it affects us as a community, as a hospital, and also as a country. You've seen a lot of budget cuts to the healthcare funding, and a lot of hospitals having to close. Hiring freezes, things like that. So this here that we're going to talk about, healthcare disparities, is very important to us as well. The definition is differences among populations in the availability, accessibility, and quality of healthcare services. It's estimated that the economy loses $309 billion per year because of direct and indirect cost of disparities. So what this means for us and for our patients is that issues with health insurance or quality of care, healthcare associated infections, things like that are not only causing the hospital itself to lose money, but the entire economy. So like I said, this affects us being able to find jobs in the future and future generations of nurses being able to find work. And then it also limits the accessibility of healthcare for all populations if we're shutting down hospitals, especially in rural communities or impoverished communities. So that's something we really need to be thinking about. So let's address these healthcare disparities for a minute. It's estimated that by 2050, the percentage of racial and ethnic minority groups will be 50% of our total population. The population of age 65 and above is expected to rise from 35.9 million in 2003 to 44.7 million in 2013, and to more than double at 98 million in 2060. The number of people in poverty is 48.8 million. That's 15.9% of the population. 12% of U.S. adults are proficient in obtaining, processing, and understanding basic health information and services needed to make appropriate health decisions. That's less than half of the population. So we talked about culture and how it can affect someone's accessibility to healthcare. But what is culture? We define it as norms, values, and traditions passed down through generations, ethnicity, race, nationality and language, gender, sexual orientation, location, class, and immigration status. Oh, I'm sorry. It's important for us to understand what makes up a person's culture because someone might be African American, but they could have grown up in Ohio or in a very rural community, or perhaps they look white, but they're from somewhere in Europe where it's completely different and they have different customs and means of approaching healthcare. So we really need to get to know our patients as a whole. So what is oppression and how does that tie into our topic today? Oppression is formal and informal system of disadvantages and advantages tied to our membership in social groups, such as those at work, at school, and in families. They impact individuals' access to resources such as healthcare, housing, education, employment, and legal services. So when we talk oppression, we're not just talking about discrimination or things like that. This is the way that our country and our government and our different facilities that we have are run that are affecting people's abilities to live a full life. This topic was a bit too long to squeeze into one video, so this is going to be in 2 parts. So just be sure you watch them in order so you don't get them all mixed up.